My name's Maria. I'm one of Dr. Lawton's nurses. I've been working for Dr. Lawton since about 2003, shortly after I received my Bachelor's of Science degree in nursing at the University of Texas. I couldn't have asked for a better person to work for than Dr. Lawton. His knowledge, his skill, I believe are key in having a successful practice. On a more personal level, over 14 years that we've been working together, he's become more family. And that's basically what we are, is just a little family, which I think is important in having a successful practice.
Here with Dr. Lawton, he specializes in breast and body, so he does breast augmentation, breast reduction, breast lift, abdominoplasties, which is tummy tuck, and liposuction procedures. He can also do Botox and fillers.
Hi, my name is Dr. Melissa COOLEY. I'm the nurse practitioner here at TrueMed. Dr. Lawton is a very unique surgeon because he believes that his power and ability to do all the outwardly changes that he does as a remarkable surgeon is enhanced with healing. We do many weight loss programs here, getting hormone replacement therapy. We do HCG, also appetite suppressants, regenerative medicine. We do metabolic boosters, lipo B shots. It is not a one-size-fits-all. So whatever works best for you is what we will do together. So working in and out, making your goals real.
He has a love for his patients. He is there from the beginning to the end. He's a perfectionist, and that's something you want to see in a doctor. Since I work alongside with him in the operating room and clinic, I get to see firsthand what his work ethics are. I'm proud to say I'm one of his registered nurses.
I'm Dr. Mark MELISH. I'm one of the anesthesiologists that practice for Dr. Lawton. I graduated from the University of Texas Southwestern Medical School in 1984 and then completed a one-year general surgery residency and followed by an anesthesia residency at the University of Texas Health Science Center at San Antonio. I love working here. This is great. The standards are very high. We are very in tune with the patient's concerns. I've been doing primarily cosmetic and plastic surgery since I've been in private practice.
He's just a really great doctor. I mean, he's personable. He wants them to have the best experience in surgery from the beginning to the end. So he wants them to have, when they come in for the consultation, he wants to make sure that they feel comfortable here with his staff, with the nurses, the front desk.
He's very honest, and if a patient, wants something and if they're not a really good candidate for it, he's not going to push the patient or force the patient to have the surgery. He gives you his honest opinion. Any questions that the patient may have, he always answers them and just spends as much time as the patient needs with them.
My name's Marissa McBride, and I am a permanent cosmetics artist and a microblading artist. And I am co-branded with Dr. Lawton because several months ago I had a vision of bringing permanent cosmetics to the plastic surgery field and the plastic surgery echelon.
For those of you who don't know a lot about microblading, it involves a manual hand tool, very fine blade that's used to place hair-like strokes in the upper layer of the skin. It provides the opportunity to use the most natural approach and gives a very natural hair stroke pattern.
I'm really proud to be partnered with Dr. Lawton and co-branded with him.
My name is Gary Lawton. I'm a board-certified plastic surgeon. I've been in practice in San Antonio for 17 years. My practice is concentrated on cosmetic surgery. I graduated from medical school with honors. Attended Yale University, where I was trained in general surgery and plastic surgery. I did 2 years of wound healing research at Yale University, which really provides an advantage because the science of wound healing plays a big role in everything that happens after the surgery. We have our own fully certified outpatient surgery center. This sets us apart from most people. It's a quadruple ASF Class C operating room. Allows me to control all the variables. We see the patients the first day after surgery to make sure that everything went well with the operation. And the nurses are highly qualified, trained, and skilled. They've been with me since I've started. We look forward to seeing you soon. Thank you for your time. It's an honor for me to have an opportunity to operate on you, and I hope to earn your respect, to meet your expectations and your goals.